So welcome everyone. I'm really pleased to get to moderate this session for us. So every year, of course, here at the Dahdaleh Institute, we have a Global Health Trainee Symposium. So this is our second annual one, if I'm not mistaken, which is really exciting. So thank you so much for submitting and for coming to be willing to share your work with everyone. So I'm delighted we have a mix of folks. We have some graduate students with us and some undergraduate students with us as well. The idea is we'll have an opportunity for everyone to share pieces of their research. And then the whole idea really is for us to focus on a little bit of discussion. So that's why we sort of compress your presentation time, and we want to give some room to give you an opportunity to discuss amongst yourselves as well, and explore. So I'll just introduce myself as well for those who might not know me. So I'm Tareq. I'm an associate professor of global health here at York. I'm in the field of global health. I'm also the director of the Global Food and Health Systems Research Group at York, and I'm the director of a newly formed, just launching this summer, WHO Collaborating Center in Disease Prevention Policy and Systems Science. And I'm also a faculty fellow here at the Dahdaleh Institute. So it's a thrill to be able to moderate this and be part of this discussion. So as usual practice, of course, we want to start off today with a land acknowledgement. We have a land acknowledgement here, which is York's land acknowledgement. I also just want to make a note that, of course, our land acknowledgements are in constant revision and they're a subject of dialogue. And so I'm going to read portions of this and might be modified a little bit. But so to share this, the First Nations people have lived on this land or this part of Turtle Island for millennia, stewarding the land, the water, and all that contributes to life in this region. Today, the culture and presence of First Nations, Inuit, and Métis peoples enrich the lands and people of this territory. York University's campus, of course, where we're at, is situated on the traditional territories of the Huron-Wendat and the Haudenosaunee people. And it's also, we like to do these land acknowledgements to say out loud and give acknowledgement that it's our collective responsibility to honor the land as we honor and respect those who have gone before us, those who are here and those who have yet to come. We are grateful for the opportunity to be learning, working, and thriving on this land, and we commit to learn the truth and be active in the process of reconciliation. It's just a statement as well. And with that, I'll switch very awkwardly to logistics. So we're not very connected to the land at all in logistics. So we'll spend a little bit of time together. Everyone will have an opportunity to share their research. The whole kind of event that we like to host is about 2 hours. So we'll break it up into two pieces. There'll be 3 presentations, a 20-minute discussion, a little bit of a break, 3 presentations, 20-minute discussion, a little bit of a break. And to circle back to the land acknowledgement a little bit, when we take our break, feel free to, take a moment for yourself and think about where you are and what you're connected to. And then we'll try to wrap up on time so you all can get on with your comprehensive exams and your undergraduate work and things that you need to do. So that'll be at just before 1 o'clock. And then a few gentle reminders. If the symposium, of course, will be recorded. So as you can see, we've got some great setup here to capture the discussion and the presentations. So we just, for folks online, especially if you could mute your microphone unless you're presenting, that would be a big help as well. I'm quite flexible in how we moderate. So my suggestion would be, just because we'll probably have a little bit of time to work with, that we do a presentation and open it up if there's any sort of burning questions. Does that work for everyone?
Yeah.
And then we'll definitely have dedicated time where we can do like crosstalk between the presentations. Does that sound good?
Yes.
All right. Great. Well, with that, I would like to welcome our first presenter. So our first presenter is online. So Rupsha is joining us. Rupsha is a PhD student in the Faculty of Health. Her work focuses on co-design and service design to improve the quality of life for people living with dementia in global communities by addressing loneliness. Welcome, Rupsha. Nice to see you again. Floor is yours.
Thank you for the introduction, Tara. So today I'm really excited to share some of the results of a preliminary study that I did to inform my dissertation proposal. The paper has been accepted at the Relating Systems Thinking and Design Symposium in Turin, Italy, and will be published as a full paper as part of the conference proceedings in 2027. Dementia is a progressive neurodegenerative family of conditions, as you all may know. It affects the ability to process memories, task sequencing, and other complex executive functions related to cognition. So dementia was identified as a global health priority by the WHO due to the lack of a cure, making it a chronic condition people manage for decades, the rising cost of care, and the expected rise in population of people living with dementia, particularly in low to middle income countries by 2050. Loneliness uniquely affects people living with dementia due to the compounding effects of individual, interpersonal, institutional, and political factors. If these factors seem familiar to you, they all fit within the socioecological model of health that you all may know. And systems thinking enhances the socioecological model by looking at the relationship between these factors instead of just identifying the factors. Meanwhile, the design philosophy of systemic design uses systems thinking to find key intervention points for the purposes of design. The paper explores people living with dementia's experiences with loneliness while navigating everyday activities with supports such as technology, services, and different practices. And we map these experiences into a systems map to look at identifying leverage points that inform the design of technologies and services. So we conducted 2 co-design workshops, one in an urban community setting at York University and one in a rural setting at an assisted living care facility, Short Hills Retirement Community in Southern Ontario. Recruited 14 people living with dementia and 13 caregivers through our community partners. We also recruited 3 technology developers through our own professional networks. The technology, isolation, daily life, and everyday activities tool was a co-creation tool we used to facilitate the co-design process for the different participants. The TIDE tool provides prompts sequentially through a printed canvas exploring social circles, activities that foster social connection and loneliness, technology, services, items, or practices which support connection, technology, services, items that make people feel lonely, positive feelings and impressions they have about their social world, and negative feelings and impressions they have about their social world. Alongside the TIDE canvas, we provided a curated set of images, quotes about loneliness from English literature, tactile materials such as Play-Doh and Lego, and sticky notes so that participants could creatively explore the prompts and respond to them either verbally or by attaching the curated materials to the canvas. TIDE was completed in pairs, a person with dementia either with their caregiver or with a technology developer, and this was followed by group discussions. We thematically analyzed the transcripts and the tools from the sessions and completed that within Atlas TI to identify system variables. We then used co-occurrences in Atlas TI to find relationships between the variables, which were used to identify intervention points in the overall system. You can see here the 3 key leverage points here are the rapid development of technologies, cultivating digital exclusion. Loneliness is deteriorating the sense of identity, while sense of identity also affects loneliness. And then the mixed loop of rituals and everyday activities being used to address loneliness. So the preliminary study helped me inform my dissertation proposal alongside other comprehensive exam materials like my scoping review, my concept analysis, and my dissertation focuses on designing an evidence-based service for people living with dementia, which helps them address loneliness through rituals. And if we have the time, I really want to thank my supervision committee, our community partners, the research team at SATS Lab, and all the participants within the study. I'm really sorry. I can't I don't have audio anymore for some reason.
No, should be okay now.
Oh, okay.
Okay, cool.
Can you hear me okay now, Rupsha?
Yes.
Okay. Well, we thanked you and you got a round of applause.
Okay, great. Thanks.
Great work, great presentation. Thank you. So yeah, I wanted to open the floor. Chelsea, please go ahead.
Amazing work, Rupsha. It's so amazing seeing also like the progress in your work over this last year. I was just curious, is the like consent procedure for like attaining consent for individuals with dementia a little bit different than how you typically go about it in a study? I was curious about the process.
Yeah, so it really depends on the stage of dementia that the participants are at. So we work in consultation with them, with their caregivers, to understand if they're in early stages or moderate stages or even late stages. And based on that, either they can provide consent for themselves, or we do have, a proxy that will provide consent for them. The ethics office is also really great in sort of providing advisory on the consent process. So they review all our materials. We also have scripts to provide verbal consent because reading can be difficult for people with dementia, especially a form that's full of jargon. If you guys are, familiar with ethics forms, you know that. So yeah, all done in a very big consultation setting with people with lived experiences on the participant side, and then our ethics board and our wonderful at work. Yeah.
Thank you. That's really interesting.
No question. Yeah.
What great presentation, Rupsha. What was one of the more challenging aspects of conducting this study that you kind of came across? Maybe something that you weren't expecting?
Yeah, I think the hardest part of this study, well, there were a couple of difficult things, was the development of the co-creation tool. So, I could probably spend an hour just talking about that. It took months. Again, consultations with our lab members, the community partners, caregivers to just say, hey, is this going to actually work? Are people going to engage with it? So that was quite difficult, and I'm glad I got to know that part before I wrote my proposal and I go on to doing further studies. The analysis of the data was also quite challenging because how do you analyze such heterogeneous data together? And then the logistics of, how are we going to get a team to a very small town in Ontario all in one piece? How are participants going to be compensated for the study? So everyone got an honorarium, all of that stuff, all of the fun stuff was quite challenging.
Good question. Any other burning questions before a bigger discussion? Okay, thank you so much, Rupsha.
Thank you.
Okay, so our next presenter is here with us. So Tareq. So Tareq's a PhD student in the Faculty of Health. His research examines the lived experiences of family caregivers of racialized and minority children with autism spectrum disorder in Canada. So you have the floor.
Thank you so much, Shere, for this wonderful introduction. Let me just start saying that, parenting an autistic child is both a journey and a privilege. Good morning to all of you, and I'm presenting today my update about my research, and it's part also of my comprehensive paper. So my main topic is all about community programs supporting caregivers in terms of their health and well-being. Specifically, I'm examining the programs that can be candidate for social prescribing model, which I will talk about a little bit more later. Now, everyone knows that autism is a lifelong journey that begins very early in life. And in Canada, the Public Health Agency of Canada in 2022 reports that 1 in 50 children and youth are now diagnosed with autism. That means 2%. But we can understand probably it's estimated, understudied, undercalculated. So you can imagine, for example, the numbers. So while the focus is often on the child, my research centers on the caregivers, primarily mothers, who manage an overwhelming volume of responsibilities that extend beyond the traditional parenting, which we all know. So this research matters because of many reasons and because of our current systems. Current systems are following the very people who hold the family unit together. So why it's a priority right now? There are many reasons. To consider, for example, the economic scale. Informal caregivers contribute to the Canadian system and the economy to an estimated $97.1 billion annually. And that can be in form of unpaid labor to the Canadian economy. Yet the contribution comes at a very high cost. The cost will be paid by the caregivers themselves because they are experiencing many challenges and difficulties in terms of their psychology, in terms of mental health, physical exhaustion as well. Now, I want just to highlight one point that we need to recognize the bidirectional nature of health because a child's emotional dysregulation can directly predict the worsening of a parent's mental health. So this creates a cycle of stress that is compounded for racialized and immigrant communities here in Canada because they face multiple challenges as well, specifically linguistic inequity and systemic racism. So often leading to a much later diagnosis compared to their Canadian-born counterparts. So I'm calling here for a need for a paradigm shift. We must move away from the biomedical model that views autism as a deficit to be cured towards a neurodivergent perspective that frames the autism as a nature variation of human experience. So if we are calling for autism to be looked from a different angle, also we want to look at caregivers' health and well-being also from another angle, which is not only biomedical, but also social and community-based health. So what is the problem right now? We have fragmented healthcare system, fragmented educational system, and social services, which they don't communicate with each other, and they are all siloed and reactive. Caregivers right now in Canada are currently trapped in a maze of bureaucracy, acting as the sole bridge between different systems, which are totally uncooperative. So the most striking gap identified in the literature, which is the referral gap, in one study, it showed that the caregivers and support groups were referred by a clinician in 25%, whereas the remaining 75% done by the caregivers themselves. So they had to do their own research and explore the possibilities, how they can communicate, how they can improve their well-being and health in the community until they reach that support groups. Furthermore, there is a two-tiered system in Canada. So if you want, for example, quick diagnosis, quick therapy, you need to pay, and it's very high cost, high out-of-pocket cost for essential therapies. Means only the wealthiest families in Canada can access adequate care. Additionally, in my research and scoping review, which I will present in the next slide briefly, that there are major inconsistencies. While autism is a lifelong journey and the caregivers are having those challenges for their lifetime, I found in the scoping review that we have only certain interventions and studies talking about feasibility and pilot studies which lack longitudinal data. And this is overwhelming to represent the high income, and because they are representing mainly high income and white population, ignoring the racialized communities, which is my target population. And this is a profound lack of proactive integration between primary care and community-based social programs, a gap which I call for social prescribing model to be designed and to fill this gap specifically. So in my scoping review, which I presented in my comprehensive paper, that I wanted to explore the support programs for caregivers and assist them for the candidacy of social prescribing model. Social prescribing model is defined as the connection between the primary care, or public health, and community-based organizations and community-based professionals to improve the client's well-being and health. And in my case, my clients are the caregivers, not only parents, the caregivers of autistic individuals. So I conducted a scoping review using the ARCSI and the Malays framework, synthesizing 11 articles based on health promotion framework and interprofessional collaboration theories. And those articles I collected from 4 countries: Canada, the US, the UK, and Australia. And yes, only 11 articles, which means we have a huge gap in the literature to talk about the caregivers of autistic individuals specifically. And I found a major contribution, apart from the thematic analysis I have done, that the link worker is an essential mechanism to bridge these systematic silos. And we found like multiple programs in the literature and the scoping review, including Envisage and New and Next CARES program, which was conducted here in Toronto. And those are really ideal for social prescribing model because they are co-designed and peer-led by other caregivers, and they focus on empowerment of the caregivers themselves. So these programs move the parents from being on the passenger seat to the driver's seat of their child's care. Furthermore, it suits also the racialized communities here in Canada because some of them have been conducted by peer-led. That means other caregivers who have the lived experience being the trainers and the facilitators for those workshops, which is really great because it emphasizes on the culturally safe models. Now, my next research, which I will be proposing in my proposal later, that I will be conducting a mixed method approach in collaboration with a Toronto-based community organization to examine the role of link worker between health providers and community professionals to see if we can really improve the health of caregivers of autistic individuals. The data will be collected as long as it's a mixed method by surveys, semi-structured interviews, a focus group, and the good thing is the workshops will be culturally safe and co-designed by the caregivers themselves. Before I conclude, I want to say the final words. Social prescribing is not just a referral system. It's a pathway for health equity. And by formalizing the link worker between clinicians and community programs, we can ensure that caregivers' health is not a secondary goal, but instead it's a primary necessity for the flourishing of the entire family system. Here, I would like to thank my supervisor, Prof. Farah Ahmed, and also the Dahdaleh Institute for Global Health for their support. Over to you.
Thank you. Excellent. Okay, I'd like to open up the floor. Does anybody have any questions? Oh, I heard a name. Yes, please, go ahead. Go ahead, Naima. Or maybe, Naima, can you hear us?
Can you hear me now?
Oh, yes. Yeah.
Okay, so sorry about that. Tareq, thank you so much for this presentation. I think it's so important, and just the fact that you're also focusing on caregivers is truly, yeah, like I'm looking forward to what comes out of this research. I guess I just had a more specific question about the autism spectrum, and if you were like also going to be focusing on high functioning or the lack of diagnosis and support for caregivers, caring for their autistic children who mask autism well, and the lack of services that are then made available to them, or are you just looking at it like generally?
Yeah, you're right. I want to acknowledge that autism is a spectrum, and we want all the caregivers from who are taking care of children or individuals, and I meant by individuals even like the adults, right? Mm-hmm. So we want all caregivers with all, for example, caregiving experiences or their children needs, individualistic, for example, needs to join our program. So it's not only about, for example, like high functioning or masking or whatever, but we understand also through the through the scoping review. I was able to find differences between the responses of the caregivers to the programs based on the children's status or their functionality. So I can acknowledge that, but we welcome everyone. We welcome all caregivers. Caregivers, not only parents, even, for example, sometimes grandparents, sometimes siblings. So everyone can join the program. Yeah.
Thank you. Great question. Yes.
Yeah, thank you very much for this very important research. Autism is a big problem. We're all aware of them.
And
I was
great
looking
to-
at
oh, there you go, volume. Perfect.
looking at your focus. You said you were focusing on Canada, USA, Australia.
That was the scoping review. But my focus is actually on the racialized communities in Canada.
So that takes me to the next question. How do you intend to capture multicultural groups within Canada, your methodology?
Yeah, that's a really great question. As of today, we have many associations and organizations which are taking care of the kids, the autistic individuals, right? So some of them are really somehow racialized. They serve the racialized communities here in Canada or the new immigrants, etc. So they have the database for the children. So we can communicate with the same organizations and connect with their families. So those families can join our program and see, for example, if the link worker concept as social prescribing works well for them in terms of improving their health and well-being.
So do you intend to do any comparison between
my focus on the racialized communities mainly. So
are you going to compare in between the different?
Oh, you mean within the racialized communities? Could be the data could be stratified because the racialized communities doesn't mean, for example, not only South Asians or only, for example, Asians or other communities. So based on the numbers we are recruiting, maybe we can stratify the data and find the differences. Yeah, that's possible.
Yeah, that would be something of interest.
Yes, exactly. Yeah. Thank you.
One quick follow-up is are you envisioning, or currently either based on the literature or what you're envisioning as next steps, is this a program that's embedded within traditional healthcare, or do you see this as something that is complementary but outside of?
Actually, I mean, this concept is not happening here in Canada.
Yeah.
It's there somehow in the UK because social prescribing model has started in the UK almost 2 decades ago. So the concept, for example, that a physician or primary care or family physician to refer, for example, a client or a patient to a social or community organization or social professional or community professional is not something we have it right now in the system. So it will be a pilot study and feasibility study to check out, for example, can we advise for such kind of implementation in our healthcare system? And instead of having those caregivers going to the community organizations on their own and nobody communicates between family physicians and community organizations. No communication. And sometimes, because of the biomedical, concept we have, that, for example, any anxiety, depression, okay, let's go for medication, antidepressants, medications, right? But probably because they have too much pressure, there is no, for example, empowerment skills, caregiving skills. Some of them, for example, heard of autism for the first time during the diagnosis itself. Some of them that don't have, for example, that background to know about autism. So it's coming for the very first time during the diagnosis experience. So that experience is really somehow overwhelming to many caregivers. So they have no idea where to go, where to start, and navigating the entire system, how to get the diagnosis, official diagnosis, any funding, for example, from the government. Some of them, they have no idea. So they wait 1 or 2 years, paying out of pocket, not able to understand, for example, where to get the fund or the support from the government or the community organizations. And those 1 or 2 years are really precious for the children. So sometimes they are aging 5 or 6, okay? They get the diagnosis, official diagnosis, but after that, they need certain support. So if they spend 1 or 2 years just navigating the system, these 1 or 2 years are really precious for the children.
Yeah. Something to think about then, if you do have ambitions for a program like you see a need, you build an evidence base. It's just some of the work that I do, we very often sort of call it positioning our research for use. And there's some key aspects that we add to our research process to try to do, if you want to change systems with it eventually, or you feel like in order to really embed this and have impact longer term, you might have to try to embed it. Then there's just some key things sometimes that you can start to do, engaging stakeholders and bringing them in and finding the policy levers that the health system sort of decision makers might be able to pull on, or a budget that they might be able to fit this under,
Sure.
to make them commit to it and all that kind of strategic thinking behind it. It seems like a great project. I'm sure you're already thinking about those things, but it seems like a perfect fit for that kind of like almost strategic research.
Sure. Thanks. We'll talk during
the break. That's right. And thanks for sharing. It sounds amazing. Okay, great. Thank you so much. So we have our final speaker before the break, also online. So joining us online. So Farzana, sorry. Am I pronouncing it correctly?
It's Farzana.
Farzana, thank you. Farzana. So Farzana is with us. She's a third-year undergraduate student pursuing a Bachelor of Science in the Global Health Program at York, of course, and a TB Initiative Research Assistant at the Dahdaleh Institute. So Farzana, please take it away.
Thank you so much, Dr. Penny, for the introduction. Hi, everyone. My name is Farzana Khalid, and I am currently a tuberculosis research assistant with the Social Science and Health Innovation for Tuberculosis, which is also known as SHIFT-TB. I want to start by saying thank you to the Dahdaleh Institute and Dr. Amrita for giving me the opportunity to be a part of this work and share some of the research that I've been doing over this summer. Now, when I first started, Dr. Amrita suggested that I read a book called Everything is Tuberculosis by John Green to better help me understand what TB is and what the work SHIFT-TB aims to do. Now, one story that really stuck with me was Henry's, who is a young man in Sierra Leone living with tuberculosis. His short story showed me that tuberculosis extends far beyond diagnosis and treatment, but it's shaped by stigma, community, access to care, and other social factors. Now, there's this one line from the book that I keep coming back to, which says, TB doesn't just flow through the meandering river of injustice. TB broadens and deepens that river. Now, throughout my work, I began to understand how TB both reflects and reinforces existing inequities. Now, I want to give a little bit of an introduction to what SHIFT-TB is. It basically brings together researchers, practitioners, and learners from different settings around the world to connect social science with tuberculosis and practice. Now, my role has given me the opportunity to contribute to a lot of areas of this work. Firstly, I help manage the SHIFT-TB website, newsletters, LinkedIn, our daily emails, our resource publications, and I've also been supporting our research initiatives through our journal clubs, our publication interviews, and through knowledge translation. Now, I quickly realized that this is the work that shapes how research is shared and understood. If people can't access or relate to this research, its impact is ultimately limited. Now, one of my major tasks was developing a coding and tagging system for TB literature. So I organized literature around themes such as stigma, equity, mental health, and other social factors. But quickly I saw how interconnected all these themes were. For example, one article showed me how stigma can affect care seeking, provider interactions, and access to care. And it shows me that the way we organize research can also shape the connections we see in that research. Now, as my work is progressing, I've also had the opportunity to become more involved in the research process itself. More recently, I've been helping translate field notes and data from researchers on the field globally, providing the immediate language support that they need. Now, this has given me the opportunity to directly engage with researchers through qualitative data and see how they try to capture people's experiences and their realities on ground. Now, I've also helped organize our SHIFT-TB journal clubs, which have been one of my favorite parts of my work. Now, they allowed me to move beyond research and understand the literature that we collect critically and discuss it through the study design, through its context, through its implications. Now, our most recent session focused on community-based and peer-led tuberculosis intervention in Indonesia, which explored different themes such as stigma, depression, and the quality of life amongst those living with tuberculosis. Now, another part of my work that has really stood out to me has been connecting with researchers working in very different settings. Now, through SHIFT-TB, I've interacted with researchers across the world, from India to Ukraine to Tibet, and many more. For our upcoming September newsletter, for example, I have been working with researchers to gather diverse tuberculosis perspectives, including a health economic one, as well as helping to edit and publish a field note which highlights tuberculosis care in Tibet and community resilience. Now, I've also recently supported our Ask the Expert interviews, including one focused on Inuit TB care. This was another experience that I really enjoyed because it gave me the gave me a behind the scenes look at research. So when you read a research paper, you typically see the final product. But when you get to interview researchers, you see their experiences, their challenges, and the context behind the work that went into that paper. Now, moreover, this summer, I had the opportunity to work and meet with PhD students and postdocs, which gave me valuable insight into graduate school and academic research. Now, as a third-year global health student, it also helped me learn about the different careers available to me and think more intentionally about the paths that I aim to pursue. Now, my biggest takeaway from Shift TB is that global health research is shaped by context, perspective, and people. Henry's story taught me to look beyond TB itself and consider the systems and the circumstances that shape people's experiences. And another line from this really amazing book that I recommend that you all read is ultimately, we are the cause and we must also be the cure. And that is important because for global health students or global health scholars, it means staying curious, listening and learning from communities. And that's something I hope to carry forward as I continue my work with Shift TB over the next year. Now, at the end, I want to encourage everyone to check out Shift TB on our different platforms, whether it's our website or our LinkedIn, and engage with our journal clubs, our publications, and newsletters, one of which will be published next week. So keep an eye out for that. Thank you so much.
Wonderful. Thank you, Farzana. Thank you so much for that presentation. That was really great to see. Any questions? No. Yeah, Chelsea.
Hi, Farzana. Thank you. That sounds like just an absolutely amazing experience throughout the whole research group and getting to be involved in so many things. Yeah, I was curious to just know from your perspective, what did you enjoy the most throughout all the different tasks you're part of? And I was also curious, you got embedded in quite a bit of the qualitative research components, like the translation of the transcripts and helping with the interviews. How was that for you? And was this your first time getting to do it?
Yeah, thank you so much for your question. And I'll start off with your first question about, I guess, what's the most rewarding experience for me. Earlier on in this slide, you saw a map of all the different researchers spread across the world. And I think one of the most rewarding experiences for me was being able to communicate with each and every single one of them. And I know over the summer it's been a short term, but I've been able to talk with so many different researchers and really understand what type of work they're doing in such different contexts, but in the exact same, platform, tuberculosis and social science. And I think Dr. Amrita has really helped me kind of connect some of my knowledge from my first 2 years of my undergraduate studies and implement that. So going to your point about the qualitative research that I've been helping with, this is my first time actually applying that knowledge into an actual setting. So when we talk about qualitative research in our global health courses, we talked about how interdisciplinary it is. We talk about how there are so many connections and how global health really is global. But this was my first opportunity to really see how that plays in action and participate in this research work itself. And, as somebody who's here at York, being able to contribute globally has been something that's really rewarding to me. So thank you for your question.
That's amazing, all that you've done.
Great question. Any other questions?
Yeah, that was a great presentation, Farzana. I wanted to ask, since you've had the opportunity to work with researchers and learn about them, what's something surprising that you've learned that you think many people should know about?
Thank you for that question. So before I got this position, I never really understood what Shift TB was. So when you really go into their work, you see how it's tuberculosis beyond the biomedical perspective. You look at it from a social science perspective. So when working with researchers, one of our biggest things is we always highlight that we are, an organization that seeks to highlight social science TB care specifically. And I think sometimes we just have to kind of repeat what that means. What does social science care in tuberculosis mean? So I talked about my coding system in the coding book that we developed. And that goes back to us, trying to highlight the social factors that revolve around tuberculosis. So that's something that, as researchers, as students, that's something we're trying to kind of explore and honestly just spread the message about how important social science care is in the infectious diseases and tuberculosis specifically.
Great question, great answer. Yes, please.
Yeah, thank you very much for this.
It's loud on social, I think she's online, just in case it doesn't catch you, the mic's.
All right, thank you very much for this great presentation. I was wondering, have you, beyond interacting with researchers, did you have the opportunity to interact with people suffering from TB or peer support group or other similar groups within the communities? And what, if you did, what was your experience? If you haven't, is this something you're considering and something you're looking forward to?
Thank you for your question, and that really is a great one. So I talked about a little bit how I've been helping translate field notes on the ground. So that was my first experience with actual tuberculosis patients. So I had the opportunity to read through their stories and really understand the stories that are being collected on the ground and help translate them. So not only was I translating the research, but I was understanding what was happening on the ground from the researchers collecting that qualitative data. As of now, that's been my only interaction with tuberculosis patients or tuberculosis experiences. But as my research progresses throughout the next year, I will be involved in papers and other opportunities, which I am looking forward to. So thank you again for that question.
Great. Thank you. Perfect. So I think this is a good time. We've got about 10 minutes, I think, before we take a little break. Is there anybody else that had questions for any of our presenters, or was there anything that struck you across the presentation? Yeah.
I was really interested in Rupsha's work because I've had the opportunity to work with community partners here at York, specifically Luma Care, which is an organization that provides care to seniors here. And so we also had to develop a creative project with them. And so I've had the opportunity to work with participants. And so I was just really intrigued about how that process was working with those participants and creating a project that's meant for them. It's built by them, essentially with team members and such. I want to know more about that process of how did it go working with participants? What did the team members say? And sort of that process, because those conversations and every time you work with the community, like all that has meaning for the end goal of improving well-being for those with dementia.
Great point. Great point. Rupsha, I don't know if you have any reactions or response to Jasneet.
Yeah, I mean, that's my favorite part of the process and why I got into this work is working with people with lived experiences as well as the community partners. I probably should have mentioned this, but Haley, who is probably saw on my slide, who's a co-author, she's actually our community partner. So she was actually also involved in the writing of the publication and as usual, had like really great insights. In terms of working with people with dementia, I had the real privilege of working with a group of undergraduate students in computer science from Lausanne. And it's interesting with undergraduate students, they have some fear and anxiety about interacting with people with dementia always. But they got in there and they were really excited. And the people with dementia really enjoyed working with our research assistants, and our research assistants in turn really enjoyed working with them. My work is all around rituals, and there was in the data when I was going through the transcripts, because during the workshop setting, I can't be everywhere. I have to kind of be where I'm needed. But reading and listening to those stories of cultural exchange between some of our international students and some of the older adults was really interesting, with older adults sharing, things that help them cope with loneliness, and our international students being like, oh, actually, I did that with my grandma back in, my home country. So that cultural exchange was something I didn't expect going into it. Was really intriguing to me. So I'm not sure who the question came from. Sorry, I'm online, but I echo what you say. It's the work always has meaning, and it's an ongoing partnership. So I'm excited to work with them again. But it's also really tough in that, these are older adults. So we did have some participants that passed away within the couple of months that we've been working. And that was really tough. I had to kind of step away from working on this project at some points. So even though it's challenging, I think it's worth it.
Thank you, Rupsha. Thank you for sharing that. I think injecting and accepting humanity back into research and our research process is really important, and that's a great example of reality of working with different populations. So thank you for sharing that. Appreciate it. And there's a hand up actually. I think
Greg, go ahead.
Oh,
Hi. I just had a question in terms of so you said that you were dealing with dementia patients, right? So I was just wondering, how did you account for the idea that some of their experiences might not be rooted in, like, I don't want to say reality, but some of, like, their disease could have shaped some of their experiences and the way they kind of relate them. Was there any part of the research that accounted for that? Or did you just take everything on face value when they were describing their experiences? Thank you.
Yeah, that's a really great question and one I get very often. I think there is not to say a misconception, but our understanding of dementia is so shaped by our societal interactions with it. Like there's media, there's like the stereotypes. And I would go back to like my initial point about staging. So, not every person with dementia has the same experience. I work with this really great organization called AgeWell, and they say if you met one person with dementia, you've literally just met one person with dementia. Like it's not a homogeneous experience. So we work very closely with the community partners. We work very closely with caregivers who know the participants really well and often better than we do. And we talk to them. We say, is this an appropriate study for this participant to participate in? Because we are going to talk about loneliness. We are going to talk about everyday activities. And we actually don't focus on reminiscence very much. We focus on, oh, what did you do this afternoon? What did your day look like yesterday? So we focus in on the moment. So we're not asking them to recall per se. We also focus on sort of, the interaction between the caregiver and the person with dementia. So that co-creation tool is really meant to be a conversational prompt. And the data comes from that conversation. So often if the person with dementia is maybe getting off track, we've seen the caregiver kind of step in and say, are you sure that's correct? I mean, you did this differently this other day. When you're, analyzing the data, you often have to make those calls as well. Is the caregiver correct or is the person with dementia correct? And that can be really tough. But we try to approach the research from multiple angles. We also do, not in this study, but we do observational studies. We may do walk-through interviews where we go into people's homes and they might do an activity and we kind of talk them through the activity. So a lot of our work isn't, focused on recalling memories per se, but kind of in the moment.
any other curiosities, broad-based questions?
I had a question for Tareq. Your presentation was amazing. I just wanted to ask you, what inspired you to do this research work that you are so passionate about? It's very interesting hearing about, especially because autism is something that's still currently being researched heavily through different lenses, biomedical, even the social lens. And so I just want to know what's inspiring you.
Actually, there are 2 points which I want to share with all of you. The first one, because I came from healthcare management background, so I wanted to do really something related to healthcare systems management, which is also my stream. Now, second, which is somehow personal, when I was like younger, probably like in undergrad, I was part of Autism Society back home. Then I dealt with children of autism, and I dealt with also caregivers. Okay, so we had like a tournament, etc., sports games. with all the children and the caregivers. So I can relate to that part. Plus, my supervisor area is also about like autism, etc. So it was like somehow very great match between her interest, my experience, all together with healthcare management and health systems management as well. So that was like my main passion about this.
Great. Thank you for sharing that as well. We really appreciate it. I mean, one just broad observation, maybe from my perspective as someone that's kind of not been embedded completely in biomedical research, but sort of came up alongside that, like public health, population health, and global health. We have a long way to go, and our healthcare systems have not kept up, but a dialogue like this with students across different faculties and schools with very different focus on different aspects of health and integrating social science with mental health, with design approaches, this is 10 years ago, I wouldn't have been at a seminar like this of a mix of undergrads and graduate students and faculty. So even just the dialogue that happens in this room, I think, and the humanity in each of your questions and your interest in the research and passionate reasons why you might study a certain topic. I feel like these things are there's more momentum behind them than I can recall in the past, 10, 15 years. And so I am personally very excited to see biomedicine take its place, but that it's not the only thing around the table. There's other perspectives and different data sources in Rupsha, like different analysis of different kinds of information that we're starting to feel are very acceptable forms of evidence that we can produce and hopefully make policy and system change with. So thank you so much. With that, if it's okay, we will just take our little mini break. We will come back here for around 12:05. Does that work for everyone? 15 minutes stretch, connect with the place, and we'll see you guys in just a few minutes. Okay.
Thank you.
Okay. Thank you so much. A little round of applause for everyone. Perfect. So welcome back. Hope you had a nice little 15-minute break or so. So we are going to have our last three presentations. So we are going to start first with Mahnoor, who's going to share her work with us. She's pursuing you're in global health. Great. A minor in psychology. You're a global health intern working as an AMR policy accelerator research assistant. So you're with the Global Strategy Lab. Please, so take it away.
Hi, thank you, Dr. Penny, for the introduction. I'm excited to share with you all the work I have been doing at the Global Strategy Lab under the supervision and leadership of Dr. Lauren Wallace and Dr. Arnie Rucker. I have been assisting them with qualitative research on antimicrobial resistance at the lab. I have grown so much throughout this experience, and yeah, let's get started. So, Dr. Penny, your introduction has already perfectly summarized me. So I'll just briefly go over some more details about myself and provide some more background on the unit I am a part of at the lab. So my name is Mahnoor Shere. I am currently a student in the Global Health program at York University, pursuing my Bachelor of Science. I am a research assistant in the AMR Policy Accelerator at the Global Strategy Lab. Antimicrobial resistance, AMR for short, is when bacteria, fungi, viruses, and parasites become unresponsive to antimicrobials, which are often used to treat infections, thus making it more challenging and in some cases impossible to treat some of them. This increases the risk of disease prevalence, illness, disability, and death. The AMR Policy Accelerator, AMRPA for short, is a knowledge to policy initiative at the lab that advances evidence-based AMR policymaking. Activities within this initiative include 3 interconnected streams: policy research, policy translation, and capacity strengthening. The current project I am working on is a scoping review on AMR research agendas. So now I will introduce my project. It is titled Antimicrobial Resistance Research Agendas and Their Feasibility, Policy Relevance, and Equity Considerations, a Rapid Scoping Review. The aim of the scoping review is to inform a virtual expert dialogue with AMR experts to support the development of the independent panel on evidence for action against AMR. IPEA for short. The IPEA is led by the Quadripartite, which consists of the World Health Organization, Food and Agriculture Organization of the United Nations Environment Program, and World Organization for Animal Health. It will provide countries with appropriate evidence and guidance that can help them effectively address AMR. The three research questions guiding the scoping review are: what AMR research priorities and evidence gaps exist across global, regional, and national peer-reviewed and grade literature, and how are they thematically distributed? How are considerations for the feasibility and policy relevance of these priorities described in existing research agendas? And how have equity considerations been incorporated into existing AMR research agendas? Now I will go over the methodology of the scoping review. This review follows a qualitative process in which existing peer-reviewed and grade literature were selected through searches on academic databases such as PubMed, Scopus, and Web of Science. The literature was screened using Covidence and coded thematically with MaxQDA. The literature will be analyzed using a deductive-inductive approach that will be conveyed through a narrative synthesis. Overall, as I continue working on this project, I have learned that AMR is a multifaceted global health issue, and as such, it requires research, development, and innovation across multiple domains using inter and transdisciplinary approaches to address it. Another key observation of mine is that scope and context are very important for AMR research. It is fundamental to have an adequate understanding of the specific AMR landscape within different countries to appropriately address it with effective governance and interventions. Lastly, I will go over my progress and some next steps for this project. Throughout my experience of working on this project at the Global Strategy Lab, I was able to develop my qualitative research skills. This was my first time extensively working on qualitative research, and I was able to become efficient in database searching, literature screening, and knowledge synthesis. I was also able to become more proficient in using MaxQDA to thematically code literature, and I'm working on honing my narrative writing skills. As I continue working on this project, my supervisors and I look forward to completing the evidence synthesis and mapping. We then want to begin drafting our findings into a policy brief and peer-reviewed journal article that will feed into a virtual expert dialogue. We hope the dialogue will identify high-impact policy relevant and feasible priority themes that will support the development of IPEA's work program. Thank you all so much for your attention. I look forward to answering any questions and engaging with you briefly after and during our upcoming Q&A session. I would also like to give a special thank you and shout out to Dr. Lauren Wallace and Dr. Arnie Ruckert at Global Strategy Lab. They have been a tremendous support, and I look forward to learning more from them as we continue our work.
I'd like to open it up if anybody has any questions. Yeah.
Excellent presentation. It looks like it's been an amazing experience at the Global Strategy Lab. I was just curious, because I'm so used to with the scoping review doing like data extraction through Excel, but what did that look like for using MaxQDA for coding?
So with MaxQDA for coding, it kind of looked like I would read the full text of all of the literature that we were deciding to include in the study. And then after reading the full text of the literature, I would essentially, we have a coding frame that we follow that was, previously agreed upon before we began our full text screening. And with regards to the coding frame, I would go through the literature and kind of find different themes that were in relation to the three research questions that we have, and to see how they kind of like fit into the kind of themes we were wanting to explore. A lot of themes were coming up with regards to different interventions for mitigating antimicrobial resistance. And we were also finding a lot about different, equity considerations as well.
So thank you.
Thank you.
Any other? Just wondering, was there anything that surprised you about the whole process? Was this the first time you really undertook a big kind of like evidence synthesis?
Yes, it was. And what kind of surprised me about the process is how much was adjusted as we were going along with the process. It was very much a, work as you go kind of process where if there were some things that we, initially thought of that, didn't really pan out as we were doing it, we kind of went back, adjusted and readjusted the coding frame and just kind of so that it better encompassed the findings of what we were looking through the different literature and also kind of what we wanted to explore further.
Yeah, that's a great point. So there was a more iteration than you would have imagined at the beginning.
It was a very much iterative process, which I was coming from an undergrad perspective. When you learn about research in your courses, it was definitely different because, you kind of like from an undergrad perspective, you go in with a plan and you do the plan. And then, working this, I realized, no, but like over time, you learn more as you start doing, right? And as you learn to adjust and change and reframe so that, and, better encompasses all of the different perspectives and the different things that you're learning.
That's right. Great point. And I think I heard, oh, yes, please go ahead.
Hi, I just had a question for the broader objectives of the study. I was just wondering, how would intersectionality be accounted for? Because you did mention context, so that got me thinking about that. Thank you.
So thank you for your question, Ibra. So as we were going through the scoping, we were trying to just see how kind of map the different research priorities and the themes coming across the different AMR research agendas that have been, currently that have been published. And so we kind of we're trying to get like more so a general idea. Obviously, throughout as I was going through some of the research agendas that have been published by reputable organizations such as the WHO, you can kind of get a sense as they do, they do account for the importance of considering different, equity factors such as, how different solutions and strategies should be implemented within lower middle income countries. So to kind of get that intersectionality within, obviously as researchers, we understand that, we do have some, pre-existing, understandings, but also learning to take into account that not everything is applicable everywhere. And that has been a key theme that has come up. I hope that answers your question.
Thanks. Okay. We've got questions. Perfect. Okay. Thank you so much.
Thank you so much.
Yeah.
Thank you.
Okay, so our next presenter, Jasneet, who is a global health student specializing in health promotion, disease prevention, and a global health intern working with HEATSCAPE-Africa project.
Thank you so much, Dr. Penny. My name is Jasneet Kaur. I'm a global health student in my final year, specializing in health promotion and disease prevention, and I'm honored to be here today. So HEATSCAPE-Africa is a major research project that's aiming to explore the relationship between heat exposure and mental health, specifically among climate vulnerable populations. The essence of this project is to build knowledge gaps of how heat exposure impacts the most vulnerable, often countries in the global south, and how findings can support them as global temperatures are rising. My main tasks include working on an exploratory research paper and presentation on wearable devices and supporting the project through developing communications such as a website and newsletter. So this was one of my bigger tasks that I was working on. And so it is a wearables report and presentation that I'm still doing. And it initially began as an exploratory project where I was just learning about different technologies existed that are used in research, used in sleep research, and collected information. I also had the chance to talk with manufacturers who have created these devices to learn more about these devices. Now, the importance of this task supports the qualitative portion of the study that hopes to use these devices, such as the actigraph watches, which are wearable watches, alongside eye buttons, which are temperature sensors, to measure different metrics, including sleep in relation to extreme heat. To add on, I'll be working with different experts that our team has, supporting them with other considerations such as data privacy, statistical approaches, with wearable watches such as staggering them, and evaluating which watch would best fit the qualitative studies goal. These considerations are crucial to ensure that the project practices ethical research protocols by protecting participants' data, safeguarding participants' well-being, and ensuring that the technologies used support the project's goal, because they are quite expensive. So the next task that I've been working on is communications and supporting with databases. So our goal is to develop a website alongside newsletter as our main forms of communications. The importance of outreach is paramount, as this could lead to collaboration with other organizations and projects to continue this research. Additionally, more attention on the topic and research can help influence public policy, which can translate to improved well-being as policy shapes the conditions which we're born, live, and grow in. Ultimately, the root causes of our health, which are the social determinants of health. Communication is essential towards delivering research findings more accessibly and globally. And so our team has kickstarted many things. So for our website and newsletter that I'll be working on alongside other members, the design and branding is kind of dependent on our logo. And so interestingly, our project is doing a logo design competition with participants in Ghana and Zimbabwe. And this task really demonstrates the mindset of our project, where we really want to work with the community members, learn and discuss about their experiences, and get them really involved, because we want this project to be meaningful and to make it a collaborative process in which our team actually has, we're working with different organizations and working with different partners. It's a huge, huge project. And I think it's really important that we're really involving participants with logo design and just the whole study process, because it really builds a solid foundation, working with the participants to gain a deeper understanding. And that deeper understanding helps us with our research and helps for aiming for better health and better mental health. And so my experience as a research assistant for HEATSCAPE-Africa has led to new skills and capabilities that can help the different prospects in the future. And I'm beyond grateful to this project. I'd like to conclude by thanking my manager, Nell Ganguly, who's provided me with endless support alongside Dr. Weabong. I'd also like to thank my colleagues, Yasmin, Manush, Ikra, and Manib, who have helped me and taught me many things. I'd also like to thank both Teresa and Natalie. Thank you so much.
Lovely, thank you. Really exciting. Any questions?
We got lots of questions. I was just curious, for the devices that you're going to be using for kind of tracking how the response is within heat, can you tell me a bit more about like the study design of like kind of what is the objectives? What are you hoping to kind of find from this?
So my main tasks were just to learn about the devices. We still have to do piloting and ensuring what exactly metric. We know sleep is something that we're really interested in learning about. Also, alongside other things, because these watches can measure heart rate, physical activity, sleep is the main thing that we're also looking at. We're looking at how heat exposure can impact sleep, heart rate, and physical activity. And then the temperature sensors are also going to be used to measure humidity and temperature and fluctuations, and to see how heat exposure can impact mental health. And so these devices would be an add-on to the qualitative study to help us understand those relations.
And who is the target population again?
So it's climate vulnerable populations in Ghana and Zimbabwe, so younger children, mid of reproductive age, and older adults.
Very interesting. Thank you.
Any other questions?
Yeah, thank you. Excellent presentation. Can you give us a sense of how you intend to select your study?
So selecting the study participants is out of my scope. Maybe someone from the team can speak on that. But from my end, we have participants that we're interested in, both in Ghana and Zimbabwe. I think we have community partners that might help with that process of identifying participants. But from my end, I've heard that we're looking at younger children, women of reproductive age, and older adults as our sort of target audience. And all in all, they are climate vulnerable populations overall is what the project aims to look at.
Great. And what did you think of the process for the competition for the logo design?
So I've heard that the logo competition is like it's on its way, so we haven't gotten results yet. But I think it's really important in terms of how participants see this topic, heat exposure and mental health, and how that will be reflected in the logo, because art is another way of expressing how we think, believe, and how we see the world, right? And so we hope to write some pieces on different participants and their logos to really understand what does extreme heat mean for people. And that sort of creative process, I think it's really important to integrate and research other non-academic ways of doing things, right? And so I think I really like that the team decided to do a local competition. I'm really excited to see what will actually be chosen.
Yeah, I'd be very interested in the outcome and like the process. It's really unique. I think that's a really great.
Yeah, we have more findings to come your way, so to look out for HEATSCAPE-Africa.
Excellent. Rupsha, yes, please go ahead.
I'm also working on HEATSCAPE-Africa, so I just wanted to add that the logo competition was basically aiming to be a capacity building exercise, because these participants they have obviously lived experience, so their personal perspectives will I guess get deeply integrated into like how they view their experiences, and that will essentially lead to knowledge translation, if you will, in terms of what we're hoping to get out of these lived experience um, interactions. Thank you.
Good point. Thanks for sharing that. Any other last questions for Jasneet? Looks good. Great.
Thank you, guys.
Great. So our final, last but not least, of course, final presenter will be Chelsea, who's a PhD student in global health. Your research looks at child and youth engagement in climate change governance worldwide, exploring who is able to access these spaces, how much agency young people have within them, and how participation affects their well-being. Okay, Chelsea, over to you.
Should I turn on my video? Yes. Okay. Hey. Oh, I don't need to unmute myself right now, right? Okay. All right. Hi, everybody. Thank you so much for this space to be able to present the work. Yes, my name is Chelsea, and my presentation is a scoping review I've been working on for my PhD called Mapping Child and Youth Engagement in Climate Change Governance, a scoping review of access, agency, and well-being. I want to thank my co-authors that have helped support this work, as well as my supervisory committee, who have also been incredibly supportive through this process. Next slide, please. Okay, so why does this topic matter? So children around the world are uniquely vulnerable to climate change for many reasons. So they have longer lifetime exposures to the impacts of climate change. They have developing bodies and minds. They are dependent on adults and have unequal social conditions that shape their exposure and protection. These vulnerabilities are not experienced equally and are intersecting through poverty, geography, disability, ingenuity, race, gender, political context, meaning that some children face much greater climate change-related risks than others. With this context, so the key point of my literature review that I did is that children, they're not only vulnerable to the climate change impacts, but their voices are often excluded or limited from decision-making spaces that are shaping climate change policy. So the review overall asks of when children and youth are within these spaces, what does their participation actually look like? Next slide, please. So this is the guiding questions, both for the review as well as for my PhD, where I'm trying to understand this continuum of engagement from start to finish. So before participation, what is shaping children's and youth's interest within climate change spaces and what motivated them? From an access and recruitment standpoint, who is gaining access and who may be left out? During participation, how are children's voices acknowledged, constrained, or reflected within decision-making? And after participation, of what outcomes follow for children, youth agency, as well as well-being and policy influence. Thank you. Next slide. So overall, there was 4,000 studies collected from 6 databases, and we had 46 that met the criteria. So also specifically, this review is looking at invited spaces. So these are spaces where adults are inviting children and youth in to kind of come speak and participate. So before participation, concern for the future and intergenerational justice was the most common reason that people wanted to participate in this kind of governance space, as well as their emotions around climate change and fear, anger, guilt, as well as hope very much was encouraging. A lot of children had also experienced the lived climate impacts from climate change, and this shaped them wanting to be involved and to participate, as well as some were just also motivated by skill building, leadership, and potential career pathways. From an access and recruitment standpoint, it looked different in different spaces, but it was often controlled by institutions. So young people usually were entering through a youth organization, through their school, an NGO, but oftentimes their participation was dependent on, they had some barriers such as visas, having funding, English language capabilities, and adult gatekeeping. So this often meant that these pathways were privileging older, well-connected, English-speaking youth, particularly from the global north. Throughout participation, young people were active, but the type of power that they had in these spaces was quite different. So they would participate through speeches, consultations, workshops, advisory roles, but it was often structured. So they were kind of told what they were allowed to do within these spaces and had very predefined roles that they could play. And some youth also described fear in being able to speak out about what they truly felt. And it was quite kind of moderated because if they spoke out against who they were representing, then this could affect their future access within these spaces. And then after participation, it was found that from like local and community-based kind of spaces that brought them in, this often had more meaningful outcomes where they could actually see the policy impact or that they had within their communities. Whereas within an international space, it did provide visibility, networking, and advocacy opportunities, but their policy influence was not very well documented. There would be very weak follow-up with them, as well as a lot of times of tokenistic participation. Next slide, please. From a mental health and well-being standpoint, it was shown that participation can be very protective when young people are experiencing hope, pride, empowerment, feeling peer connection and solidarity, feeling like they are also safe in this space and had supportive adults, and a strong sense that their voice actually mattered and was leading towards something. However, the participation could also create a strong emotional burden through feeling like burnout, frustration, as well as eco-anxiety, feeling like they were being tokenized or youth-washed within these spaces, having to self-censor what they were allowed to say, as well as this burden of responsibility without actually having real decision-making power. Next slide, please. Finally, I want to thank the Dahdaleh Institute, which has created an amazing workspace and supportive research environment, mentorship, and guidance from the various members on how to conduct a scoping review. As well, I'm very grateful because I have received funding to be able to continue my PhD research, as well as I got to present this work at the Bold Ideas for Brighter Futures conference in May, where I met so many amazing people and got to network and share this work. And from a next step standpoint, so I will be presenting this work in Montreal in October at the Canadian Conference of Global Health. I'm planning to finalize this very shortly and turn it into a full manuscript for publication, hopefully soon. Alongside, I'm also conducting a complementary review. As I said before, this one was on invited spaces, whereas this other review is going to be on claimed spaces. So these are spaces where youth are kind of taking the leadership role, like they are claiming their spot. Such as like a school strike or a youth NGO, and also looking at participation in climate change governance there. And then overall, this is building into my broader PhD research program. Thank you, everybody, very much, and I look forward to your questions.
Thank you. Thank you, Chelsea.
Thank you so much.
Presentation. So let's open it up for you. Any questions? Chelsea.
Yeah, I thought it was really interesting that you brought in the intersections of mental health amongst learning about your project between climate change and youth governance. So I was kind of curious on that process. How did mental health come about within your scope of review process? Was it something that you saw in the literature that came up?
Yes, so thank you for that question. I was very interested as I was going through, there's quite a lot of qualitative literature on what's been happening and people talking about their experiences within this space. And there's both there is positive commentary about like feeling this empowerment or feeling like a part of something bigger than yourself. But then also there's a lot of people talking about extremely negative experiences that they've had within this. Also, there was examples of the policing at these spaces and feeling unsafe or feeling unsafe like those that were not like white coming in and feeling unsafe and targeted in these spaces too. And it was also taking quite like a mental health toll on people, as well as many were saying like I keep showing up, I'm doing this, I'm advocating, and it's not leading to any difference. And it was very defeating for a lot of individuals. So I thought this is definitely something that's prevalent for youth that are like taking like kind of their childhood in order to advocate for something that like should be like an adult's responsibility to take care of, but they are having to kind of have this burden. So I think mental health plays quite a part, as well as from like an eco-anxiety standpoint. Like that is something prevalent, I think, amongst most youth and children. So that's also talked about a lot in the literature. So I thought it was important to incorporate within this. Thank you.
Great point. Great question. Any other question? Oh, sorry. Yeah. Farzana, please go ahead.
Yeah, thank you so much, Chelsea, for sharing some of the work you've been doing. I really enjoyed listening to it. Now, I'm wondering, you talked about the different stages of participation. So I'm wondering, did the children's engagement and participation change from, before and after and just across those stages? And if there were any significant changes from them?
Yeah, it's a good question. It's actually something that's a little bit tricky to find within the review, but I'm hoping to be able to figure that out within my PhD research once I kind of am hearing people's stories from kind of like start to finish and learning about this experience. But yeah, it's not necessarily always talked about, like how this shift has changed throughout their kind of lives of being involved. But sorry, your original question was like how it's changed from motivation to actually being a part of it.
Yeah,
Yeah,
correct.
I think. Oh, sorry. I think a lot of people go in kind of excited to be able to participate, but realize that sometimes what it actually looks like within these kind of invited adult institutions is not necessarily what they had envisioned, and hoping that they would be able to have a bigger impact than it is actually allowed within these spaces. Thank you. Sorry, I think actually you had a question before.
Yeah. Thank you for the excellent presentation. I was just reflecting. I remember that today is World Humanitarian Day.
Oh.
and we know that climate change governance is connected with security. And we also know that China youth engagement is key for community engagement. Is this something that you're thinking about looking at in the work?
Of how, like, within.
Because when you talk about lived experiences, there are different seasons.
Yes.
Not climatic seasons, seasons of lived experiences, including times that they are faced with climate-related or climate-sensitive crisis.
Yeah.
So is this something you're looking at this process?
It's definitely something I'm.
Including research that has been done in this area and what is the nexus with this community or youth engagement approaches you're looking at?
Thank you so much. It's definitely something I'm hoping to be able to, because I hope to do qualitative interviews with youth that have been previously involved in these spaces. But something that I think I'm going to be finding is, because a lot of the people who have access into these spaces are those in more privileged positions, that those that maybe don't have as much like lived experience or are facing the burdens of climate change as much, a lot of times they're not actually being able to like speak their voice into what is happening or have access to these spaces. So it'll, I guess, depend a bit, like I'm hoping to be able to kind of do targeted recruitment to be able to also hear from those that are very much like living within the consequences of climate change. And I completely agree with you that like youth participation and such is so key within this kind of sphere of what is happening. So that's one other thing which I didn't get a chance to talk about, is I also hope that within this research I can embed youth to be involved in some sort of like a committee as well, to be able to kind of have a say on how this research direction goes. So that's I'm not reinforcing the things of like adults choosing what's going to happen. So that's something I'm hoping to include as well. Thank you.
Great.
I just had a question. So from this experience, what is something that you think that we can learn from youth with regards to what their role within this kind of like climate atmosphere, and what are some key lessons that we can take forward?
Thank you so much. I think something I'm learning quite a bit is that sometimes this like ambiguous, like, let's involve youth, like, and then we are inclusive and this is going to be great, is like, yes, from like the outside, that is very nice to be more inclusive, but to not necessarily have like some form of like definition of like how is their involvement going to, like, what is that going to lead to, and have kind of follow up and plan for how they can be meaningfully incorporated. Because I think that's what a lot of the challenges that youth are experiencing is feeling like they're just being tokenized within these spaces and feeling like, yep, we have a youth, so check mark, we're good, we're still going to go with our plans, but at least we had youth there. So I think being able to, like, for these organizations that are bringing youth in and like youth are spending their time to be able to do this, is making sure that it can be meaningful to them and being able to see also like how their participation is leading to something in specific. I think that's something that would allow for this to be a lot more of a rewarding experience for people to be involved in and less of like a defeat. Thank you.
Maybe one quick follow just off of that. I was thinking that pattern you described around, you know, accessibility to these sort of spaces where power might happen, you know, the range of what is acceptable participation, and then that like minimal direct in actual influence on like a decision. It just sounds like a very, I mean, I understand that you're focused on like youth climate governance. I feel like that is like a very common pattern. It's like you can apply that to any marginalized group or any system of power or any, and it just, do you run into a lot of really high level, like generalized literature that talks about these big forces and then try to apply them? Is that okay?
Yes, it's also something that like Carrie and I have been trying to figure out, because we're looking at this like process of participation, and like there is a lot of commonalities, and like we're like, this could be applied in a lot of different areas. So there was also discussion of like, should we shift it to be just more general around youth participation in many different spaces? But then I was thinking like, I'm like, uh-oh, am I getting broader and broader with my research question? So it's like climate change is kind of the space where I think I can ground it for now, but I do think it's something that can be applied hopefully in the future in other advocacy spaces for youth to be involved, because I do see the applicability in a lot of different areas.
Yeah, and I imagine there's a lot of areas of either like political science or social science where they're talking about this at like a very high theoretical level of how power works and how a political strategy works and all of those kinds of ideas. Yeah, very interesting.
Definitely within the theory kind of review of within power, and then also the claimed faiths review is kind of showing a little bit more of like children and youth being able to take the power back, which has been quite cool to see. So thank you.
Great. Thank you, Chelsea. And I heard a oh yes, sorry, I see it again. Yeah, Ikra, please go ahead.
Hi. Thank you so much, Chelsea, for an amazing presentation. It's really interesting work that you're doing. I just had a question about, you mentioned eco-anxiety. I was just wondering, like, how did you come about kind of standardizing definitions of what eco-anxiety would mean, and how did that get conveyed or relayed to the youth or the adolescents, if you will, that are involved?
Thank you so much. So within this review, honestly, I've allowed it to be relatively open. It's not necessarily having to stay within a predefined box of what eco-anxiety is, because I've seen that it can be both like a barrier, but also a driver for why people want to be involved. So yeah, it's not necessarily something I've tried to limit the definition. Like if I'm finding within the literature that it's being talked about or it's being talked about in a roundabout way without saying eco-anxiety, I'm still kind of coding it as a form of eco-anxiety that they have about concern for their futures due to climate change.
Thanks.
Thank you.
Wonderful. Well, thank you, Chelsea. So one more quick round. Thank everyone who participated in this round of assessment. So I'm just going to open up the discussion. We've got about 5 or 10 minutes remaining where we can talk about anything you'd like to talk about, the research or what you're doing next or whatever is most useful to discuss. So maybe I'll start with just opening it up. Does anybody have any burning thoughts, questions, reflections? Yes, Kelsey, please.
I was just curious, I guess because I've also been in a role like supporting like a student, like undergraduate students, like what has been most like, what has helped you be supportive and like how can like graduate students or like supervisors for you like help make this a very positive and like good experience to continue wanting to work within these research spaces?
Okay, I can go first. I think really what has helped me is my supervisor being very active and being very understanding in that I am, learning a lot of these things for the first time and being very, having a very, kind of open policy of come to me for any concerns or questions or any guidance. That's been it's been tremendous to have that support. And as I go further with learning more about the different aspects of qualitative research, it's been very reassuring that, I don't have to have it all figured out, and they understand and they welcome questions and they understand that I'm also learning as well. And so, yeah, just very open environment and open communication between, student and supervisor. Yeah, that has been the best experience.
I think for me, both my manager and supervisor, they've let me take on challenges that I thought I couldn't do. So they really believed in me and really thought that, hey, you can do this, like present here. They really wanted me to join the team and be a part of the team. So our team has like monthly meetings. And so I was able to join those and like learn more from the experts because our project has so many research colleagues and fellows. And so they've let me join in spaces where I thought, like, I personally thought, how could I come here? But they've been very inviting and encouraging. And that has led me to develop more skills and learn, obviously, because I'm invited into new spaces where researchers are discussing projects and other things, and I'm getting to learn that. And they've just been very supportive. And I also work with my manager a lot, so I see her all the time. I've had many discussions with her, and just being able to be close with her and talk with her is just something that I find that really helps because she's right there and I can ask questions and go on with my day.
Great answers. Yeah, Farzana, please go ahead.
Yeah, going off of my peers, I think something that's really helped me is Dr. Amrita is my supervisor, and initially she wanted to have a meeting with me and discuss some of my career goals and future plans. And even though I didn't have everything set into place, we had that conversation about what do I want to take out of the work that I'm doing. So when I talked to her about the research, that's when she started getting me involved in qualitative research, data analysis. And I think just having that open connection with your supervisor or with your colleagues is incredibly important. And at the same time, I think they give you that sort of confidence and knowing that, just because you're a second year or third year global health student doesn't mean you don't have the skills to do the work. So this is kind of just a shout out to Dr. Amrita, who's been an amazing supervisor and, who's kind of, I think she initially said, we don't have that professor-student boundaries in this space because we're researchers. That's how we work. I think just creating that open space has really helped me, I think, take the most out of the work that's being done and hopefully continue to as well.
Thank you. Thank you so much. And you just described why I absolutely love it. I can second and third that the love for Amrita. Well, any other thoughts? Like, amazing question.
I have a question for all of the graduate researchers here, because graduate studies is kind of you pursuing what is inspiring you and what you want to contribute to the field. So I just wanted to ask, what was the process like transitioning from maybe starting off with your master's and then going into your PhD? How was that different? What did you not expect? Is this a path that you initially, were you knew you always wanted to go on, or was it just something that came up because you just got so inspired and passionate about what you're doing?
Start first. Maybe let me just tell you something about myself. I came from corporate, like an experience, like many years in corporate experience. So in terms of research, etc., I didn't have that exposure. So I took it as a challenge first to get into research. Also, I want to leave an impression, for example, even in the society, how can I help, for example, marginalized groups, racialized groups, a certain population, the same what I'm covering right now. So I want to help in practical way. So I thought, for example, getting into PhD program will give me those skills. And indeed, I got those skills. I learned many skills, for example, which probably you are doing right now in my PhD, which was, for example, really great experience for you to do all that work at this level. So I think it was challenging, and I accepted the challenge. Yeah. It's not an easy thing, for example, even for those who have been in research and in an academic for many years to go into PhD program. But I believe it's worth the time and experience to go for graduate studies. Yeah, that's from my side.
Thank you. So I went into my undergrad for nursing thinking I am done with school after this. I have a job and I will never have to do school ever again. But then I kept kind of being curious and wanting to kind of figure out, well, wait, why are patients coming back? And then kind of transitioned into public health, did some more school, and really enjoyed that. I find I get very easily passionate about whatever I'm kind of currently embedded in, but then had the opportunity to be embedded within research projects for a role I had, and was like, ooh, I also really, really like this as well. And that kind of got me thinking, I'm like, well, I could keep doing this. And it kind of felt like a natural next step to continue doing research. And I think there's a lot of negative commentary about doing a PhD, that it's going to be the worst time of your life and it's going to be extremely painful, but it doesn't have to be. So I think especially the way that the PhD program is structured here, you get to really just delve into something that you're so passionate about and that you love, and that's such so cool to be able to have this time to fully envelop yourself, and it's been such a positive experience. So yeah, that's my journey so far. Thank you.
Thank you. What a great question as well. Yeah.
Is Rupsha still on?
No, Rupsha.
Oh, okay.
Yeah. Wonderful. Does anybody else have any questions they would like, things they'd like to explore? Yeah.
So I know from what I've heard from others that having a strong passion and burning desire during your PhD is what's going to keep your momentum going for completing, reaching that finish line. Kind of curious, within your research area or topic, what's something that keeps you up at night that really kind of helps you continue that momentum?
Definitely, the milestones expected from you as a graduate student sometimes create pressure. Okay, because not every PhD student has the same life and experience, etc. So there are multiple responsibilities. You have life, you have work, you have family, you have connection. You are alone. You are with people to support you, and different age. For example, those PhD students, start their program. Some of them start at 24. Some of them, I have, for example, my classmate is 60 plus. Okay, so there is no age, for example, for to start your PhD. But I think, for example, the milestones can be a little bit tight for some people. So sometimes that pressure is really difficult to keep with all other responsibilities at the same time. But thankfully, for example, and I want just to emphasize on something, that if you have, for example, a great supervisor, your life will be amazing during the PhD, because they understand your circumstances, your responsibilities, etc., and they can offer certain accommodation or support tailored for you, which can be, for example, relieving for your milestone and experience. Now, in terms, for example, of the PhD itself, whenever, for example, like you start reading about something, especially the topic of interest, you find yourself, okay, I want to read more. I want to read more. Then your idea is always about this. Sometimes you dream, you have dreams, okay? What about okay, this program? Okay, you wake up at night, okay. I forgot, for example, to add like one line in my manuscript, something like this, okay? So it's funny, but sometimes I felt I'm so engaged in the PhD, in the reviews, literature review, in my reading sometimes, forgetting about like, you know, our regular life like our ordinary things we do in life. So my recommendation after like having all those experiences probably is to have a balance between your like, you know, work-life balance. The same way it's work, so don't like engage yourself too like 100%. So look at your life as well, like, you know, to have certain balance. Yeah.
Thank you. Is it like topically what keeps us up at night, or more within the structure? Your research topic. Okay, within the research topic, I think for me it's just eco-anxiety keeps me up at night. But just knowing that like it's not getting better, it's getting worse, and like seeing how like I have like nieces and nephews that I'm thinking about, and I'm seeing how they're going to grow up into this, and it's very like that's very motivating for me. But I'm also keeps me up at night of like, well, I want to make things better for them, and being able to make sure that like whatever like that it's going to be a good world that they get to grow up into. So I think that's keeping me up at night. But from like PhD perspective, I think just like keeping track of deadlines and stuff, that can be also it can be quite challenging at times when you've got lots of things going on. But I do think something that can also help is not always just doing your PhD work and only doing your own specific topic, like trying also like helping out with other research projects or getting involved in something else, I think is very helpful to not just be all consumed by just specifically in research. At least for me, that's something I found to be quite helpful. Thank you.
This is excellent advice. I'm so glad we're recording this. It's like a tutorial session on undergradding to gradding. Excellent work. Thank you. So we're about at time, but I just wanted everyone to give a quick round again for some excellent work. The absolute stellar questions that have been asked online and in this room are just next level. So congratulations, everyone, for not just doing some amazing research, but engaging in one of the most important parts of research, which is dialogue. And also for the mentorship that I've seen just blossom in this room. I thank you for the excellent questions to each other and keeping that discussion going in the room and online. This is how we are going to tackle some of our biggest global challenges. I think I am just so relieved and grateful to see folks like yourself in rooms like this, taking time away from family, taking time away from life, putting energy and passion into this kind of work. This is how we're going to do this, right? So I just leave feeling, kind of lifted up by all of your experiences and the discussion. And we can totally do this. We can totally, systems, we built the systems, we can remake the systems, we can unbuild the systems. That's just, I don't believe anything other than that. We just need to figure out what are the right things to do and, get in the right rooms with the right power players to make it happen. So lovely. Thank you all so much again. And congratulations. And please enjoy some balance in the remaining time you have in the summer. And then we can all come back in September, all excited to get going for another academic year. So thank you again so much.
Thank you.
Thanks everyone online too.